The creatine coffee question is an interesting one.
What exactly is creatine, and then how does it work in the body?
The scientific evidence says that it is safe and effective in that population.
Do you have a favorite brand that you trust and that we can recommend to our patients? Welcome back to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. I'm your host, Colleen Sloan. I'm a PA, dietitian, and today we're tackling creatine, the supplement your athletes ask about, your parents should probably take, and the one that sometimes complicates lab results. My guest today is Dr. Scott Forbes, and he is the go-to guy when it comes to creatine. He's an associate professor in the Department of Physical Education Studies at Brandon University. He's authored over 90 peer-reviewed publications, including very influential studies on creatine supplementation, muscle physiology, and brain health. And today I ask him all the things that you guys wanted to know about creatine, like what populations should take it, if there are any contraindications, what's the proper dose, whether it can be mixed with coffee, and unpacking why creatinine can rise with patients taking creatine. He also unpacks some widely popular social media myths like creatine causes bloating, it's a steroid, and it will make women look too big, and exactly which formulation is optimal. So many of you have requested an episode on creatine, so let's get into it. Get comfy or drive safe and enjoy my conversation with Dr. Forbes. Dr. Scott Forbes, I am really excited to have you on the podcast. I have had so many questions about creatine, so I cannot wait to pick your brain. Welcome to the show.
Thanks for having me. And anytime I get to talk about creatine, I'm always super excited. So happy to be here and to answer some of those questions.
All right, well, let's jump right into it. And I want to start basic. What exactly is creatine? And then how does it work in the body?
Okay, so obviously creatine's not a steroid, even though we hear those claims on social media sometimes. It's just derived of 3 amino acids. So amino acids are the building blocks of protein, but if you put 3 specific amino acids together, it forms creatine. And our body can actually synthesize or make creatine primarily in our liver and kidneys. But we can also synthesize creatine in our brain as well. But once you get creatine into our body, into our blood, it's actually taken up into the muscle through a creatine transporter. And then 2/3 of that gets converted into phosphocreatine. And phosphocreatine is like stored potential energy for high intensity exercise. And we can also get it through dietary sources as well, and or commercially available supplement products as well.
Yeah, we're going to unpack supplements, but I do want to linger here because I think a lot of people forget in the supplement craze that creatine is found in some food sources. So what would be some good sources of that? And does our body utilize that just as well as maybe taking a supplement of creatine?
For sure. So yeah, it will utilize it just as well as a supplement. The one thing though is it's hard to get a high dose of creatine from those food sources. And those food sources are mainly fish, red meat, chicken, things like that. So they're all animal-based. So if you're on a plant-based diet or you're a vegan or vegetarian, you actually have lower amounts of creatine within your muscle. There's actually no difference in creatine levels in the brain because your brain can kind of look after itself and synthesize some of its own creatine. But to get about 5 grams of creatine, which is typically used in supplement studies, from those dietary sources, you'd have to consume a lot. So you'd have to consume about 2.5 pounds of salmon per day just to get 5 grams of creatine. So obviously, that's not healthy or sustainable for a variety of different reasons. But so it's often easier just to get it through that supplement form.
Yeah, that's a lot of fish. Okay. And so let's talk about supplements. There are actually a lot of forms on the market, and this can be confusing. So can you unpack those differences? And then what would be the best form for most people? And then I would love your take on gummies because these are, I think, newer to the market.
Yeah, there's about 88 different alternative forms of creatine. So creatine monohydrate is the most popular form. So it's the most studied. There was actually a recent safety review of creatine, and they evaluated 685 randomized controlled trials. They concluded it was safe, but 95% of those studies were actually using creatine monohydrate. So creatine monohydrate is definitely the most studied form of creatine. We know it's very effective. And we also know through that safety review that it's also very safe as well. So that's usually my recommendation is kind of just sticking to the science and the evidence and the safety profile of creatine monohydrate. There are alternative forms of creatine, such as creatine HCl, that has been marketed to be better absorbed than creatine monohydrate. It's a little bit easier to dissolve in liquid or water, but creatine monohydrate is almost nearly all absorbed. So it's actually not better absorbed than creatine monohydrate. And there was a recent study to evaluate creatine HCl versus creatine monohydrate with regards to some exercise adaptations. And they showed no difference between those forms of creatine. So creatine monohydrate wasn't better than creatine HCl, but also vice versa. Creatine HCl wasn't better than creatine monohydrate. And creatine monohydrate has that safety profile. It's also cheapest form of creatine as well. So that's, again, usually my recommendation.
All right, what's your thoughts on gummies? Are these as effective as like the powder form of creatine, or should we steer clear of gummies?
For sure. So I think it's important to kind of check which companies or brands you're getting these creatine gummies from. There was an independent analysis of some of the creatine gummies out there, and about half of them actually contained almost no creatine within those gummies. So it's a bit of a challenge to actually get the creatine into the gummies because if you put it in a liquid or a gel, it starts to degrade into creatinine. So that's kind of a challenge with the manufacturing of the gummies. But there were some companies that actually had creatine within them. So that's great. So maybe kind of check your sources and maybe Google search this creatine gummy analysis. But there's actually never been a study done on creatine gummies. So we still don't really know if it's truly effective based off the evidence. But we're currently running one study and we have a couple other studies planned with creatine gummies. So hopefully in the future we can confidently say that, this is an alternative form that you can actually take.
Cool. Okay, we're going to get into some populations about who you think should be taking creatine, but I'm just curious if your recommendation of how and when creatine should be taken, and especially for the powder one, is creatine okay if you mix it into hot coffee or blend it into smoothie? Just curious if there's any changes there.
Yeah, so the creatine coffee question is an interesting one because caffeine and creatine, they have opposing effects on the calcium handling at the sarcoplasmic reticulum, so within the muscle cell. So there's some theory that they could actually be kind of have a negative interaction with each other. So we did a small pilot study with regards to creatine and caffeine versus creatine alone versus caffeine alone versus a placebo. And we measured about 10 different variables. And one of the variables, we found this negative interaction. So we actually measured changes in muscle size or muscle thickness for the knee extensors, your quadricep muscles. And the creatine group got bigger over the training program, whereas the creatine and caffeine group didn't get the same increase in muscle size or muscle thickness. So one variable was different, and I've seen posts on social media that extracted that one variable and basically said never mix creatine and caffeine. But all the other variables, there was no difference. So I think we need to replicate that study. I think the evidence is pretty weak right now to show that negative interaction. So if that's your way to consume creatine, go straight ahead and take creatine in your coffee. So that's perfectly fine. We do know that taking creatine with protein or carbohydrates can increase insulin and that can help with the creatine uptake. So yeah, that's probably the best strategy is just take it in your smoothie.
And is there a specification for when someone should take it? Like with protein, we know there is some science with protein timing. Should this be done before exercise, after exercise? Does it matter if it's before bedtime? What's the optimal timing?
So timing plays a very, very small role. And if you're trying to really optimize creatine, take it close to an exercise session because basically the exercise sensitizes the muscle to take up more creatine. So there's a pretty cool study where they did unilateral cycling. So they just cycled with one leg till exhaustion. And then they took creatine and they took muscle biopsies from both legs. And the leg that exercised took up more creatine. So that's why I suggest take it close to exercise. We actually did a study looking at before versus after exercise, and there was no difference with regards to kind of adaptations. Again, muscle size, muscle thickness adaptations, or strength adaptations. So yeah, my recommendation is to take it close to exercise, but yeah, before, during, or after actually makes no difference.
All right, let's talk about who should be taking creatine. And I think this is where it's really interesting. It's been around, the sports nutrition world for a little while. So I think athletes are pretty familiar with it. But who else do you think that clinicians might be seeing in clinic that might be an idea for them to recommend to start supplementation? And then why? Like, what would be the benefits for that patient population?
For sure. So there's lots of benefits to creatine, and this is where it's really exploded in the last kind of 15, 20 years. So now we know that creatine can impact bone health and bone strength. It can impact your brain, and we know that it can improve muscle mass and muscle strength and functionality as well. So any population that could benefit from enhanced cognition, enhanced bone strength, or enhanced muscle mass and strength could really benefit from creatine. So I recommend it for a variety of different populations. Older adults trying to maintain functionality and even sit to stand performance has been improved with creatine supplementation, all the way to athletes, younger individuals, or people just trying to improve their cognitive function as well. Doctors who work night shifts and have a lot of stress in their life, creatine supplementation, I believe, could be a powerful dietary strategy.
Yeah, in nutrition, like we always want like the magic supplement for everything, fix everything. And I feel like creatine is like super close to like bordering that line that like anyone and everyone could benefit from it. So I'm curious, is there any patient population who you think should not take creatine for whatever reason?
So that's a bit of a challenging question for me because it really depends on the situation, I think, and the individual. I don't think it's necessary. It's for sure not necessary for children, for example, to be consuming creatine. There's some data that's come out with regards to creatine in pregnancy, but very limited. I still am very cautious if a female is pregnant. I probably wouldn't recommend creatine at this point, even though I have speculations that it's safe and there is a little bit of data to support that. And then individuals with kind of pre-existing kidney disease as well, still just a little bit cautious with providing, kind of higher stress on their particular kidneys with creatine as well. So those are probably the few where I think we just need more data to support the safety. But at this point, yeah, I would kind of just suggest caution.
Okay, you had mentioned children. Now, I want to move the age range up a little bit to our teens and those who are young athletes, especially soccer players, endurance athletes. I get a ton of questions about this in clinic from, kiddos anywhere from like 14 to 18 who've seen on TikTok about creatine and how it can help them. So, what is our effective and safe advice for teens, specifically who are looking for sport performance?
Yeah, for sure. And I kind of see both sides of the coin on this one as well, because, should we be giving supplements to teenagers and kind of what is the image of that? But then also the scientific evidence says that it is safe and effective in that population. We do need to be a little bit careful about some supplements contain things that we don't want it to contain. So if you're providing supplements to teenagers, I think it's really important that they're independently tested. So there's a few organizations, but one is like, it's called NSF certified supplements. That means that each kind of batch of that particular supplement has been tested to show what it says on the label is actually what's in the product. So I think that's really important. And then I think a lot of the research has shown that a lower dose of creatine can be effective over time. So I think if teenagers do want to consume creatine, I just suggest to consume kind of that low end. So maybe about 2 or 3 grams of creatine per day. And it's safe and, yeah, possibly can enhance their performance as well.
Okay, you had mentioned just then the dosing. So I want to circle back around to that and let's talk about our adult population. What is the optimal dosing for that? And then talk to us about a loading phase because I've seen this circling around as well on social media about kind of starting with a higher dose and then bumping it down. So give us some dosing 101.
For sure. Yeah. So dosing strategies on social media has kind of gone all over the place. And there's people promoting, 30 grams or 20 grams or 10 grams. And so it actually might depend on the tissue that you're trying to enhance. So for muscle performance, as little as 3 grams per day for adults. Maybe for teens or children, like 2 grams a day would be sufficient. But for adults, as little as 3 grams a day. But most people take around 5 grams per day. And that's very effective. And you do not have to do the loading phase where you take 20 grams per day. So there's again, another recent study that compared taking creatine monohydrate with the loading phase and then dropping to a maintenance dose after that 1 week of loading versus just taking a lower dose of creatine. And they showed similar exercise adaptation. So there's no need to take kind of that loading phase for sure. For brain and bone health, the evidence is that it does take a little bit higher dose of creatine. At least for bone health, we have good data to support that. For brain health, we speculate that it should be a higher dose. We don't know the best dose for the brain, but we think it's slightly higher, so maybe around 10 grams per day. Or sometimes we recommend a relative dosing strategy, which is 0.1 grams per kilogram of body weight per day. So a bigger person might need just a little bit more. And so that's why we use that relative dosing strategy. Yeah, 3 to 5 grams per day for the muscle and around 10 grams per day for bone and brain health.
Yeah, that's really helpful. Now, how long would it take for someone to see benefits? And you can kind of separate this. Obviously, if we see muscle and sport performance benefits, that might be different than cognitive function and bone health benefits. So, when should someone see an improvement in whatever goal they're looking to achieve?
For sure. So I think I need to step back just a little bit. So creatine works by providing your muscles with more energy. So you increase that phosphocreatine that I mentioned at the start of the podcast. So that just provides more energy for high intensity exercise. And then you have to do the exercise. You have to use that energy to get some adaptations. And again, it takes a little bit of time to saturate your muscles with creatine or fill up your muscles with creatine. And so if you just take 3 grams a day, it takes about 4 weeks before your muscles have about a 20% increase in that energy system. And then, of course, you have to use that energy system to see some of the exercise adaptation. So it takes a little bit of time to see some of the benefits of creatine, but essentially you should feel like you have a little bit more energy. You can do a little bit more work in the gym after about 3 or 4 weeks. From the brain perspective, there's actually some studies to show almost kind of immediate benefits or within a couple hours following ingestion of creatine. They've shown that there's enhanced cognitive function in those very acute short-term studies. So they measure a variety of different cognitive domains. Some of the cognitive domains that have been improved with creatine is attention, memory, recall, like short-term memory, and executive function as well, and also reaction time. And there's a variety of different ways to kind of test each one of those cognitive domains, but most of the time it's a computer-based test.
I think it's fascinating. Looking on the horizon, do you see any indication or maybe any future studies for neurodivergent kids, like kiddos on the autism spectrum disorder, or maybe even kiddos with ADHD to help them with cognitive function?
For sure. So we do know that the more you stress your brain, the more you kind of rely on this particular energy system, and probably the greater the benefit of creatine supplementation would be. So for example, there's evidence in Alzheimer's to show that they actually have lower creatine levels in the brain and they can have cognitive improvements with creatine supplementation. So this is a very recent study that was conducted on that population. There hasn't been any studies on ADHD that I'm aware of, but there is some link between creatine and depression, creatine and mood, creatine and anxiety, and then also some clinical populations like dementia or Alzheimer's disease as well. So I think in those situations, yeah, I think there'll be more and more evidence coming out to show that creatine can be a benefit.
Yeah, it's really exciting. Okay, I want to talk about a common, I would say, concern. I don't even like to call it a side effect because I think it's misconstrued, especially on social media. And that's when it comes to bloating or water retention. I see so many reels of like gym girlies just talking about like how bloated they are after taking creatine. So is this true? And how should clinicians explain this and what's happening to their patients?
Okay, so it's partly true, I guess, or there is some water retention that does occur. But so when you take creatine into the muscle, it will pull some water into the muscle. So it causes an increase in intracellular water retention, similar to if you consume carbohydrates. So carbohydrates, you bring it into the muscle. There's also water brought into the muscle as well. So that is essentially what creatine does. But that water retention actually causes a little bit of swelling within the muscle. And we always think of swelling as bad, but in this case, it actually stimulates muscle growth. So that's actually a good thing to bring, hydrate the muscle, bring water into the muscle, and it stimulates muscle growth. So over time, you're actually going to get kind of bigger and stronger muscles. And that's one of the mechanisms of how creatine works. And there was actually a pretty cool study in Brazil that was conducted. It was an 8-week training study, and they gave creatine and they performed resistance training or strength training. And they measured how much water was in the muscle. And they also measured the size of the muscle as well. And they looked at that ratio. So it was the ratio of intracellular water to muscle. And after 8 weeks of training, it was the exact same ratio. So what that tells me is that maybe it brings a little bit of water into the muscle at the start, but our bodies and our muscles do a really good job of regulating how much water is within it. And after 8 weeks, you actually have that same ratio. You just have a little bit bigger and stronger muscles. So we've looked at a variety of different studies and populations as well. And that bloating effect that we see on social media, we don't find that in our scientific studies. So maybe they're using other supplements. I don't know. Maybe they're doing different things. But yeah, creatine monohydrate seems to be very safe and effective and will make your muscles a little bit bigger.
Yeah, it could absolutely be from something else in their diet or something else that they're doing. And so I always just remind clinicians like, tell your patient that's not what the evidence says. Okay, you've mentioned a couple of times that creatine can help your muscles be strong and get bigger. And so to females, sometimes that's like I don't want to get bigger, right? And we've made it clear in the beginning of the podcast that you said creatine is not a steroid. So how do we balance those two? And how would you reassure a female if she is looking to take creatine, but she's scared about becoming, quote, too bulky?
A couple things. One is that females actually tend to be a little bit less responsive to creatine supplementation compared to males from a muscle mass gain perspective. And we've shown this in a few systematic reviews. And the reason why is actually females have a little bit higher resting values of creatine within their muscles. So they're already, maybe at 85% saturated, so they can get a 15% increase, whereas males are maybe about 80% saturated. They get about a 20% increase following supplementation. So they don't their muscles don't grow as big as males do from creatine supplementation. The other thing that's actually really important is we actually did a recent systematic review and meta-analysis of all the studies that used an ultrasound to look at changes in muscle thickness or muscle size. So ultrasound is a very useful technique to look at changes in muscle size. So instead of putting an ultrasound to look at a baby, we put it on muscles and we can see from the bone, and then we can see the striated tissue, and then we can see the subcutaneous adipose tissue, and we get an idea of how thick the muscle is. We put you on a training program, we can see how much that increases over time. So we looked at all the studies that use this particular technique. And what we found was those individuals that took creatine, they increased their muscle size or muscle thickness by 1 millimeter. So it's not going to turn you into the Incredible Hulk, or you're not going to become Mr. Olympia or on the Olympia stage when you take creatine. It has a really small effect. So it does work, but it's not this, big steroid-like effect that people post on social media.
Yeah, I think that's really helpful because I do see a lot of benefit for women, especially knowing that we are more at risk for osteoporosis later on in life. And so I think that there's that dual benefit there and that women don't need to be afraid of creatine. All right, I want to hear about your ideas and thoughts when it comes to concussion recovery or traumatic brain injury. Is there any research regarding that? And are there any protocols happening right now for those two cases?
For sure. So there's very limited research on traumatic brain injury. There's essentially one study, but they published it in two different parts. So there's some people say there's two studies, but it's really just one study and split into two. It was done in children and adolescents following a severe traumatic brain injury. And we do know that following a TBI that your brain creatine levels go down. So in theory, it could be of benefit to take creatine in that situation. And they did find improvements in a variety of different things that they measured when they did supplement with creatine. They supplemented a very high dose of creatine. It was actually 0.35 grams per kilogram per day in these children and adolescents. So it was a decently high dose of creatine, and they did it daily for 6 months. And it was an open labeled study, which means that the individuals taking the creatine knew that it was creatine. So that's kind of a limitation. Oftentimes we try to do a randomized, double blind, placebo controlled studies. Those are kind of the best studies. And we would like to blind the participants so they don't know if they're getting a placebo or creatine because the placebo effect is real. So that's kind of a major limitation. But that's the current evidence that we have right now. There's good animal studies to show that it could be effective taken before to either protect the brain or after to help with recovery as well. But yeah, limited evidence in humans.
Yeah, it'd be interesting to see some studies on soccer players, football, those individuals who are more at risk for concussion, just to see if it's beneficial or not.
For sure. Yeah, there is actually. So there's this marker. It's called NFL. It's neurofilament light, and it does increase when you have brain damage. And there's actually some evidence, like hitting a soccer ball, that you can increase this brain damage marker. And then there's another paper that was recently published that actually showed that if you had higher dietary creatine intake, you actually had lower levels of this particular marker. So maybe it could be, again, kind of protective to the brain. And yeah, there's some correlational data out there. But again, we need to do some really good randomized control trials to kind of tease out the benefits of creatine.
Yeah, it's so cool. Like we know so much about it, but there's still so much to study. So I'm just fascinated by it. Okay, I want to talk to my clinicians who are working with patients and they get labs back and they notice an elevated creatinine. And I've actually heard some clinicians freak out about this and forget to ask if the patient was taking creatine. So, can you clarify what is happening biochemically when someone takes creatine and their creatinine levels elevate? Is this something that we need to be worried about, or is it just a known phenomenon and we don't need to do anything further?
For sure. So creatine is non-enzymatically degraded into creatinine. And as your colleagues have noted, basically in a normal situation, if creatinine starts to be elevated, that can indicate that your kidneys are not filtering properly. And that's obviously sets off some red flags. And then you think, okay, what's going on in this particular patient? Oh, they're on dietary supplements. They would suggest go off those dietary supplements. But if you're taking creatine and you have more creatine within your body, creatinine can rise naturally. And it becomes hard to interpret if that's bad or okay or maybe good. And yeah, so that's definitely a challenge with regards to just measuring creatinine in the blood. So there are other markers that I would recommend if somebody is taking creatine. So cystatin C is another indicator of kidney function it's not influenced by muscle mass. It's not influenced by creatine supplementation, but it seems to be a decent tool to look at kidney function. So that's probably what I'd recommend. If you really want to see how well your kidneys are filtering that creatinine, then you need to measure creatinine in the blood. and in the urine as well. So that's what they've done in other kind of scientific investigations to see if creatine is impacting kidney health. And they find that it's perfectly safe if they actually measure creatinine clearance, not just in the blood. So it becomes a little bit more challenging. I understand that from a kind of physician perspective. But yeah, I think it's important because there are these benefits to creatine supplementation. So just suggesting that people go off creatine because their creatinine is elevated, I don't think is kind of putting the patient in the best situation and trying to help them, the best possible way.
And you have to have those questions, right? You can't just assume, oh my goodness, elevated creatinine, they're going into kidney failure. No, you need to ask up front, like, hey, are you taking creatine, right? This needs to be part of your history taking, especially if you're doing an annual physical. Now, if our patient is, it's me and I'm doing my physical and I say, oh yeah, I am taking creatine, I take it every day. Should the clinician just automatically tack on the cystatin C, or should they wait and see if that patient's creatinine levels are elevated?
Probably just wait and see. If it's elevated, it's not going to be elevated in every individual, especially if they're taking a lower dose of creatine. It might not be elevated. So yeah, probably just wait and see. And then if it is, then do further analysis and check for cystatin C.
This has been so helpful. And you guys, if you have any questions that I didn't ask Dr. Forbes, please shoot me a message on Instagram at Exam Room Nutrition. I'm sure he would be more than happy to answer them and we can get those answers to you. But hopefully, we touched on a lot of the high level things and questions that your patients are coming into you with. Okay, my final question for you, though, Dr. Forbes, is do you have a favorite brand that you trust and that we can recommend to our patients?
For sure. So I don't have a specific brand, but there's a manufacturer called Creapure. So there's actually only two countries in the world that make creatine monohydrate. One is from Germany. It's called Creapure, and they've supported a lot of my research and a lot of the research around the world. So I can tell you that their product is very safe and very effective. And yeah, it is probably something that I would recommend based off the evidence as well. So yeah, just there's multiple brands that use Creapure. So if they are using Creapure, they'll have a special stamp of approval or a Creapure stamp on their particular product. So that's usually what I recommend when people are looking for creatine supplement.
Awesome. And then I always encourage, like you had mentioned before, look for any supplement, whether we're talking protein supplements, creatine, collagen. You want to look for third-party testing, especially in young athletes, collegiate athletes, to make sure there's no banned substances on there. So you had mentioned NSF, certified for sport, and I also like informed choice, and those will always be on that brand that you are purchasing. So I would highly recommend that you also buy or recommend a product that has third-party testing. All right. Well, thank you so much for jumping onto the podcast and just helping clinicians give better advice about creatine. Anybody wants to hang out with you online, where can they find you?
For sure. So probably the best is just on Instagram, Scott_Forbes_PhD. If you want to follow me there, that's probably the best way to connect with me. Or they can obviously just email me at Forbes. So it's Forbes, then a second S at brandonu.ca.
Awesome. I will link to all of that down below. So if you do want to connect with him, you can just do it with a click of a button. But Dr. Forbes, thank you so much for being here. I appreciate your time.
Awesome. Thanks for having me.